my informative speech, I will be providing you information about epilepsy, the causes and effects, and the danger that it possesses. Epilepsy is a chronic disorder marked by sudden recurrent episodes of sensory disturbance, loss of consciousness, or convulsions associated with abnormal electric activity to the brain. Epilepsy is also known as seizure disorder. Epilepsy is the fourth most common neurological disorder, and it is affected to all ages. Epilepsy can be characterized by unpredictable seizures and causes more health problems. It is a spectrum condition with wide range of seizure types. Although they are very serious, they can be controlled. It just depends on the person and the seriousness of the seizure. Epilepsy affects one's safety, their relationships, work, and their driving privileges. If you have a seizure, you are not permitted to drive for 6 months until you are seizure free. Some seizures can be genetically given, but most likely, if you have a seizure, it's an uncommon reason, and people really don't know why. A seizure is a sudden surge of electric activity in the brain. It affects how a person's behaviors are for a short period of time. They are electrical activities caused by complex chemical changes that occur in nerve cells. Some seizures can be hardly noticed because you can just have a blank stare, or you could simply just be sleeping and having a seizure, while other seizures are totally disabling and could cause death. There are 6 common types of seizures. They are grand mal, absent, myoclonic, clonic, atonic, and tonic. Grand mal seizures are the worst seizures to have, and these are the ones that can cause death. The symptoms of a grand mal seizure are unconsciousness, convulsion, and muscle rigidity. The symptoms of absent seizures are brief loss of consciousness and a loss of memory. Symptoms for myoclonic seizures are sporadic and jerking movement, as well as clonic. They are repetitive, eye twitching, and jerking movements. Symptoms for tonic seizures are muscle stiffness and rigidity, and atonic symptoms are loss of muscle control. Knowing the seizure is approaching can sometimes be predictable, but not always, because some seizures do not have symptoms, but some do have symptoms before, which could be deja vu, Jameis vu, which is thinking that something happened when it really didn't. Smells, sounds, and tastes can all change. Can have blurry vision, strange feelings, feel scared or panicked, and racing thoughts. Some physical changes that can occur before a seizure are dizziness and lightheadedness, nausea and numbness or tingling. Symptoms during a seizure are similar to the ones before, but they are more intense, which would be loss of awareness, confusion, daydreaming, unable to hear during the seizure, loss of vision, flashing lights, and you can feel electric shocks going throughout your body. Some physical changes would be during the seizure, you would have difficulty talking, unable to swallow, repeated blinking, you will lose control of your urine and your stool, and your pupils could dilate, and most seizures do occur with biting of the tongue. Symptoms after a seizure are when you are slow to responding, you become very tired and confused, memory loss and not knowing that you had a seizure and not knowing what took place during your seizure. You can go through depression and sadness and anxiety. Physical changes could occur such as injuries, broken bones, or head injuries, because when you're having a seizure, if you're standing and you fall and hit your head, you can become tired, exhausted, nauseated, and you will be very thirsty because of dehydration that occurs during it. And general weakness, so it's very important that people are around when someone has a seizure so that they'll be able to get up and won't fall back down and then have another one. 1 in 26 people will develop epilepsy in their lifetime. The main causes of epilepsy are health, age, and race, which will make the development of seizures more likely. The Hispanic race is the most race that is at risk of developing epilepsy. The most common diagnosis period is from birth to the age of 1. The rate of seizures generally slows down at age 10, but is usually occurs again and more frequent at the age of 55. Because at the age of 55, that's when you're more likely to develop stroke, brain tumors, and Alzheimer's. Most seizures end on their own and have minimal concerns, while others are considered sudden, unexpected death in epilepsy, which causes fatality. 6 out of 10 people become seizure free within a few years. Medication is only used for 2 years. If you go through those 2 years and do not have a seizure, you can be taken off of the medication. A lot of imitations are referred to epilepsy, such as fainting, mini strokes, sleeping disorders, migraines with confusion, tics, tremors, and fluctuating problems, which could be confused with a seizure. Seizures are a very, very serious disorder, and I would know that because I have epilepsy myself, and seizures are not too dangerous. Thank you for listening.